This is Adam Rosh from Roshcast, and I want to welcome you to another episode of The Reveal, where I will take you inside the mind of a test taker to deconstruct and connect the dots of a board-style question so you can become a better student, transform how you learn, and excel not only on high-stakes exams, but also in your general medical knowledge. So let's get started. Okay, so we have a 23-year-old man with a history of insulin-dependent diabetes who presents to the emergency department with vomiting and shortness of breath. He recently became homeless and has not been using his insulin. On physical exam, he has a fruity odor to his breath. After 2 hours of treatment in the emergency department, his serum labs include a glucose of 190 milligrams per deciliter, sodium 133, chloride 101, and bicarbonate of 12. Which of the following is the most appropriate next step in management? All right, this is the question is rather straightforward, but I'm glancing at these answer choices here, and this is a challenging question. So what's going on here with this patient? First of all, he's a diabetic, and he's really not caring for himself. We're given the clue that the patient, he's undomiciled, recently became homeless, and he's been getting treatment in the emergency department. He doesn't seem like he's unstable or severely sick, but he does seem sick enough. And what we get here, a couple key findings. One is the fruity odor. Whenever I hear fruity odor, I think diabetic ketoacidosis or DKA. Typically, that's from the acetone that is being exhaled from the ketosis. So we have a ketosis and we have hyperglycemia. So we have the D, we have the K, and the A is going to be implied because what we have here is an anion gap, which will be caused from the metabolic acidosis. So sodium of 133, and we subtract the chloride of 101 with bicarbonate, essentially, which gives us an anion gap of 20. So we have a gentleman here who has DKA, who's been treated in the ED, but still has a gap, and his glucose it's lower, it's dropping probably from when he came in. But the issue here is he's probably been getting insulin, and now his glucose is a little too low. So what can we do here? So first of all, let's look at our answer choices. Answer choice A, allow the patient to eat a turkey sandwich. Well, clinically speaking, sometimes when diabetic patients have hypoglycemia and they're still have a normal mental status, giving food is really the best thing you could do. In this case, though, in diabetic ketoacidosis, where we're trying to be very specific and monitor, the effects of insulin and to get a really good assessment of his glucose, I'm going to say that that is not the best step in management right here. And so I'm going to cross that off in this case for now. And now let's go to C, answer choice C, discharge home with endocrinology follow-up. Well, he definitely needs endocrinology follow-up, but it's not going to be the next step in management. It will be a step down the line. So let's cross that off. Let's look at transition to subcutaneous insulin therapy. This is also attractive because his glucose is dropping here. But while he is still being treated for diabetic ketoacidosis, that should be done really intravenously, ideally. And so he may be a candidate for subcutaneous insulin therapy as the anion gap is clearing and he's going to get off an insulin drip. So this is a close one, but I'm gonna X this out. And that leaves us with change to a dextrose containing intravenous fluid. So this seems like this is the next best step in management. He is likely on an insulin drip and his glucose is a little low here. So we're going to give him some dextrose in order to be able to close that anion gap while maintaining U or slight hyperglycemia here. So let's go with answer choice B. And sure enough, we are correct. Hey everyone, before you go, if you're interested in your own QBank, whether you are an MD or DO, a PA, or an MP, simply go to roshreview.com and sign up for a free trial. See if Rosh Review's content is right for you. Keep learning, keep working hard, and always have a sense of mission about your work. Now is your time. This is Dr. Adam Rosh signing off.